Hello, and welcome to this presentation today about the device Forza Laser. Forza Laser is actually a laser lipolysis device which has been designed recently by Dermaqual Paris. What is laser lipolysis? So, laser lipolysis is actually a minimally invasive technique wherein we are targeting localized fat deposits by applying heat from a laser. This results in the permanent ability of adipocytes to store any more fat, and as a result of heat application, they are no longer going to be able to store any further fat. How does it work? So the process of laser lipolysis works in two ways. First is an effect on adipocytes, and second is an effect on skin and cutaneous tissue. On adipocytes, firstly, an applicator, which is a fiber or cannula, it can be used to deliver heat energy directly, thereby causing thermolysis of fat cells. Now, as a result of thermolysis, there is micromechanical damage and cells are totally lysed. And slowly, with the passage of time, lymphatic system can eliminate these lysed fat cells and particles. Second effect is on subcutaneous and cutaneous tissue. The thermal injury that results, it stimulates the process of neocollagenesis in the subcutaneous tissue. Because of this, there is deposition of collagen and the overlying skin contracts more, improving skin laxity. Slowly, the dermis tends to get more organized and more thicker, and newly formed collagen keeps on getting deposited. Thus, the patient experiences a dramatic improvement in the appearance of unwanted fat. There is much more improved and better skin tightening. And most importantly, the procedure allows a swift recovery time, getting patients to work on the very next day. Some advantages over traditional liposuction exist for this procedure. Number one, we are able to remove large volume of fats more easily because of the liquefaction process that results due to laser application. We are able to cover a longer area and we are able to provide more connective tissue stimulation because of heat application. Because of the process of laser, there is a heat application to tissues rather than mechanical effects, which helps to minimize trauma. And very importantly, there is minimal to no blood loss because as the laser fiber enters into the tissue, there is coagulation of blood vessels taking place all along, thus minimizing blood loss. Some major patient benefits because of this procedure includes a short downtime and resumption of normal activities within a few days. According to studies, the average time is just 1.5 days. And at the same time, there are fewer chances of ecchymosis, fibrosis, as well as nodule formation. Some indications when you will be able to perform Forza laser lipolysis, and these include localized fat deposits, which are not managed by weight loss of conventional treatment. So, for example, if you have a patient who is unable to lose a certain pocket of fat after exercise and weight loss, this treatment is the ideal treatment for them. Second category of patients include those having minimal to moderate skin laxity. Then patients having cellulite and other contour irregularities can also benefit from it. And it can also be applied on submental, abdominal, arms, and thigh areas. And ideally, the patient should have a BMI of less than 30. These are some of the areas where the treatment can be taken place. And these include lower eyelids, cheeks, as well as double chin on the face, and in the abdomen, flanks, thighs, knees, as well as lower legs, and around the buttocks and hip line, flanks, as well as back for the patient. Thus, almost all areas of the body where there are localized fat deposits, they can be treated by this laser. Some contraindications exist for this procedure, and these include severe skin laxity, in which case the patient just might be a better candidate for surgical procedure, pregnancy, keloid formers, in which you have to exercise utmost caution, patients having any active infection, any active autoimmune disease, atrophic or metabolic skin disease, overall, any medical illnesses that increase the risk for patients, as well as prior neck surgery. In prior neck surgery, this would be considered a relative contraindication because in this case, you have to exercise extra caution because of the fibrous tissue that may have formed after a previous surgery, and this can impede the manipulation of cannula. Again, this is a diagrammatic representation of the treatment areas that can be treated with this device. Now, there are some considerations which are important when we are looking at submental liposuction and laser lipolysis. So firstly, patients who are having submental fullness, they will have a blunted cervicomental angle. Often this would be more than 120 degrees, and there will be a loss of contour of the jawline and the angle of mandible. Another factor that contributes to having fullness in this region is hypertrophy of the preplatysmal fat pad. So we have to make sure that the treatment remains preplatysmal always, and the plane, the preplatysmal plane, it must never be breached. And one of the reasons for that is that marginal mandibular nerve, it lies deeper to the plane. And so it's equally important that the plane is not violated and we are safe anatomically. This is a diagrammatic representation where how we are trying to approach the submental region, and we have to make sure that we are in the safe plane. Now, some steps which explain how the operation actually takes place. Patient must be placed in the supine position, and a number 15 blade or a bigger gauge needle, it can be used to make a total of 3 stab incisions. The first incision is made on the attachment of the auricular lobe to the neck, and on both sides this should be done. And a third and final incision can be made in the midline at the submental crease. Once the incisions have been made, a tumescent solution is infused using a 2 millimeter cannula attached to a 20 ml syringe. This is the clean solution for tumescent anesthesia. You will prepare about 10 ml of 2% lidocaine, 0.4 ml of adrenaline, sodium bicarb of 4 ml, and in the saline of 40 ml. So total you will prepare this solution, and you will use about 20 to 30 cc of this mixture for a submental region. Now, once the tumescent anesthesia has been given, you will achieve blanching. And once blanching is observed, then the procedure can be started. Firstly, you should introduce the cannula at appropriate entry points and ensure there are smooth back and forth movements of the laser fiber. While the laser is interacting with the tissue, you should be able to hear a continuous popcorn sound. And use an external thermometer as a guide to ensure skin is not heated beyond 38 to 42 degrees Celsius. This is extremely important to prevent burns. Now, once sufficient energy has been delivered, the melted fat can either be suctioned or the operator may choose to leave it as it is. The lymphatic drainage of the body, it will remove the accumulated material over the next few weeks. At the end of the procedure, an extra laser pass can be applied over the inner layer of skin to induce greater collagen stimulation and skin tightening. At this point, it's extremely important to not exceed the temperature beyond 42 degrees. And since this is an internal heat application, having a post-operative blister will eventually result in a full thickness burn. Therefore, we have to be important regarding temperature caution, and we have to use the discontinuous mode of lasing. The surgeon may close the incision or they may choose to leave them open to facilitate drainage. So some of the settings that are advised, these include the 6 watts energy, discontinuous mode, infiltration of area from jaw angles and chin as a superior border and up to laryngeal prominence as the inferior border, and use of a 2 to 3 millimeters cannula. So this is a diagrammatic representation of the action of the Forza laser. A small cannula containing the laser fiber is inserted into the skin, which moves back and forth and delivers the laser energy directly to the fat cells, causing them to rupture and easily drain away. Upon contact with the laser, there is a thermal effect because of which the fat is melted and coagulation of small blood vessels takes place. At the same time, the laser energy interacts with the dermis, resulting in collagen remodulation. And all of these effects, photodynamic as well as thermal, they will give adequate skin tightening. So now with the help of this procedure, you can remove subcutaneous fat deposits, and cutaneous and subcutaneous structures can also be tightened due to the thermic effect. Because of the coagulation of vessels going on throughout the procedure, you are also able to reduce the incidence of bleeding. Some important points about post-operative care include using a compression garment to wrap the face for 7 days post-operatively, and for a further 2 weeks, advise the patient to use them at least overnight. Also, use of a lymphatic drainage massage, it can be helpful to speed up recovery by assisting drainage. Some complications which just can occur in a case of laser liposuction, but thankfully these have been drastically reduced compared to traditional liposuction. And these include hematoma formation, which may lead to airway compromise as well as skin necrosis, scar tissue formation, infection, blood clots, dimpling, nerve injury leading to numbness. At times, use of tumescent anesthesia can also lead to a temporary nerve injury, but it does recover with time. Then there can be skin burns and there can be muscle injury leading to rhabdomyolysis, especially if laser touches the muscle. The good thing is that compared to traditional liposuction, laser liposuction has none of these side effects, and only very poor technique will lead to some of these side effects. Now the device of Forza, it comes with, it gives the operator the freedom to choose either 980 nanometers wavelength or the 1470 nanometers wavelength. But at the same time, it also gives the ability to combine the two wavelengths, resulting in a dual mode operation. So generally, it is suggested that diode laser has more efficacy compared to other lasers, for example, compared to Nd:YAG. Higher wavelengths are better absorbed by fat compared to water, which is why the 1470 is more advantageous. But combination of 980 with 1470, it gives the added benefit of coagulation and reduced blood loss during treatment. So together, this laser is a very effective treatment by also reducing inflammation and bruising and giving your patients a very, very short downtime. About the Forza laser device, the device has a pulsating laser beam with synchronized emission, and this results in the photomechanical effect. This advanced laser destroys the fat membrane itself due to the thermal and mechanical effect, as well as stimulates collagen, allowing for skin to be remodeled and for new collagen to be deposited. This laser combines 1470 and 980 wavelength, and this specifically targets fat and water absorption. Infiltration and suction together with this can result in a more tightened appearance of the skin, and an integrated cannula and fiber interface for simultaneous lasing and suction. This all enables the Forza laser to perform a very effective and highly efficient treatment. So Forza laser does not damage the surrounding tissue and lymphatic system, which, if you are correctly draining the liquids and removing the dissolved fat, also reduces the risk of forming seromas. Forza laser uses the thermal properties, providing heat absorption that is approximately 40-fold higher in fat and 70-fold higher in water, respectively, compared to other diode laser. And this is possible by use of the effective wavelengths in the device. Some specification of the device include a laser system with a color touch screen, a fiber and handpiece, foot switch and power detector, and the laser system and touch screen comes with a number of settings, controls, which help to identify and input the best parameters to give your patient the best kind of treatment. These are some proposed settings for 1470 nanometers wavelength, where it's advised to use continuous mode for face, chin, arm, and knee at 3 to 5 watts, and abdomen and back 8 to 10 watts, thighs, hips, and buttocks for 12 to 15 watts. You can choose to use the pulse mode also, but it comes with a different set of settings. And the total cumulative energy that must be delivered includes this chart. The chin should be delivered about 3,300 to 8,000 joules, whereas for bigger areas like abdomen and thigh, you can go up to 10,000 and 25,000 joules respectively. Some accessories that come with this device include the safety goggles, fiber cutter, foot switch, as well as the fiber. There are also a dental handpiece, bleaching handpiece, ENT and lipolysis handpieces, focus handpiece, and other various accessories. And this is just a summarization of how the treatment is done. Forza Laser, in short, results in a very quick and very effective lipolysis, which results in a shorter downtime for patient and a quick return to work in a moderate-sized treatment area. This is a very versatile and universally operable device, and it can be very helpful for the patient as well as useful in an outpatient clinic as well. These are some of the results shared by our team of doctors. Thank you very much for your attention.